Hello, everybody. I'm excited to speak with you all today on today's agent training. Again, my name is Morgan Carver. Um, Throughout the presentation, I know we'll be covering a lot of information, so please be sure to utilize the chat for questions, and always save time at the end of the presentation for questions, and I'll be sure to circle back. So definitely utilize that, and we can always review different aspects of the site as well. For today's agent training, we're going to be walking through kind of an end-to-end solution, if you will, going through the enrollment form, as well as seeing some of the updates and new additions to the sites. So once once I'm logged in there, the first part of the site experience here is going to be the dashboard. So when we're looking at the dashboard, you can utilize different tools here as kind of the in-flight activity tracking, if you will. So as you can already start to see, this is just showing that there's no tasks for this category, but as we go through today's training, we'll see some activity populate and circle back here. So this is where you would see any kind of task follow-ups related to an enrollment, quote, scope of appointment. I'll speak a little bit more on what my Medicare.gov connections are later in the training. And then any kind of ad hoc tasks go in the other category. If we scroll back to the top of the page for the dashboard, a couple other things to point out include features like our reports or agent training materials. These can also be accessed from the agent name dropdown in the screen. So this is where you would, as the agent, log in and go to that dropdown of your name in context, and that's where you can also navigate to the reporting or agent training materials. Within the reporting tool itself, there's a few different touch points that you can pull reports on. These are the different types. So you can specify the specific enrollment and enrollment types, or select an HRA or scope of appointment for those types of reports. And this would pull in the submitted date range that you can specify. So these work in 31-day intervals or less. So once you've specified that specific date range, plus the agent username there in that field, you would run the report, and then you'd see that Excel download there where you can see the results. Within our agent training materials library, this is a resource for you to utilize in better understanding the Connecture platform. So the way I kind of like to think of the 360 learning, and also say here that this has received an update. So there's a lot of new exciting features and trainings available in our 360 learning. So in one example, you can use the search bar and look for a specific, maybe scope of appointment training, how to generate that, and you'll start to see you can identify a specific class or course and look that up. So if I select on that course, it'll take me to the bio about it. You can see that I actually had already started this session. So if I want to resume activity, I can do so by selecting that. It also keeps a timestamp. So if I want to race through the training, I can do that. But I've also bookmarked it here for later. And as you can see, this one in particular has some screenshots as well as video as part of that supporting training document. So it goes through all the scope of appointment particulars, so you can always review that. Other things I like to point out is if you want a more guided flow, maybe you'll use the group section here, and this is going to curate the training based on that assigned group. So in this sense, we're looking from an agency administrative perspective of the Plan Compare One site, and then these specific paths, essentially, you can think of this like the book on the shelf. So there's specific agent training videos and kind of a playlist that's curated specifically for that type of learning path. And if you want to read a course, or as I like to think of a specific chapter to support that book, those would be down here in the courses below. You can see the list here from those icons or from that grid view, or see the stacked list if that's more user-friendly for you. You can send this and share with a colleague, or save it for later, or simply begin the course from there as well. As you can already start to see on the right-hand side, this is going to be part of our news feed activity. So this is activity across the LMS learning system. So you can see what's taking place there. And in the upper right-hand corner is where you can see things like notifications. These would be training notifications. So this is to kind of remind me where I've enrolled or have some courses I need to resume. In the upper right-hand corner as well is your profile settings, so your personal settings, the results of those trainings, as well as the playlists that you've curated to see those different training modules. And the Create button up here, that's where you can select the specific learning need and make a learning need request. So if there's a problem where a new training would solve that, we would love to hear from you. We have a pretty generous character limit, so feel free to expand upon, who would benefit from this training and what would be the expected outcome. We really value agent feedback. You're using the tool, so again, I just throw that out there as please send us your perspective. We'd love to hear it. So that's kind of the learning management system. As I navigate back to the broker site, we're going to look through an agent perspective and see some of the other key features of the site that are going to be of benefit to the agent. So, we've kind of talked about dashboard. To navigate back to that, you'd follow the hyperlink text here next to that gear icon. You can jump ahead and look at plans. For today's demo, I'm actually going to search our existing book of business, and I'm going to see a beneficiary profile I already created and kind of work through different aspects of the enrollment flow through that lens. So I can either search, based on these different touch points, date of birth, name, confirmation number, agent username. I'm going to search by the email address. And there's a couple ways I can use this data. I can download those results, which would be copies of this as and my book of business with more member profiles, obviously, in a spreadsheet. So I can download that. The sorting default is going to go to last name, but I can change this based on what I need to see for those statuses. And you can see that quick summary about the beneficiary's name, contact information, their status as an applicant or registrant, as well as the agent name and the last updated date for that record. So we're going to work with Ben Benefits today. And what we're doing essentially is putting a member profile in context. So you'll probably hear me reference in context a lot. That becomes a key important piece as we navigate the site and make any kind of applicable changes for that member's experience, capturing their shopping, quoting, and enrollment. On the left-hand side, you'll see useful information like the personal contact information, the address. If the the sales contact may be different from the member itself, this would be a way to capture either a family member or maybe a power of attorney situation for that contact in addition to the member. Eligibility checks with that MBI number, as well as the Part A, Part B effective dates. That eligibility check is within here. We can also identify the subsidy level should the beneficiary receive extra help in paying for prescriptions. And we can check that eligibility from the profile. Further down, you'll see the state Medicaid eligibility checker. This tool, we utilize a third-party vendor known as Change Healthcare. They are working to get their change information back online for 10/1. So that's where we'll be utilizing that information check, but that's why this is not enabled just yet. So waiting for 10/1. And further below the profile, I'll circle back at the end of the demo to show how this populates, but the quote history or any kind of enrollment history, that kind of activity that has taken place for the member will show up here on their profile. Some other things to point out on the right-hand side of a member profile would be the agent of record, the scope of appointment activity, any kind of particular notes or tasks related to this member. RetireFlow was part of a new integration this year. You may have heard of RetireFlow from the agent side. This is a way to efficiently and quickly collect through a 10 question survey pharmacy, doctor, hospital information and updating that to a client's profile. That is an optional thing that agents can sign up for. So that lives on a member profile, as well as the account overview section, which I'm going to cover here in a moment. So how I'm navigating to the account overview would be selecting the agent's name and that drop down, which will take me to some other important tools like the Pearl. Pardon me while I have a little more water here. So the Pearl, also known as the personalized URL, that shopping link, that lives on the left-hand side of the account overview section. So what the Pearl essentially is a unique string of URL link that as you share that with a member and they interact with that email and select that link and work on a shopping quoting experience or start to shop, that unique identifier is a way to capture back the credit and the code for you as the agent. So for 10-1, looking ahead to the 2025 link, that's where that would live here under your account overview section right here. Retire flow, which I mentioned earlier, also on the profile and from account overview, you can sign up for that here. The profile picture, that section is on the right-hand side of account overview. So this would be your agent's picture that would show up in some of the email materials, say a quick quote or a scope of appointment that you send the beneficiary, which I'll show where that placeholder is further in the training. Some other things to take note of, right? So the agent's personal contact information, as well as their account information, and accessing, these different credentials, these different touch points would be here under account information. And then this is from an administrator view. So as far as seeing, the specific roles, you might see the selling permissions if you're an admin. I'd just like to point that out. We do have documentation that kind of explains these more in depth. So if your view looks a little more scaled back or has all these settings in it, that's just why as part of those role and permission settings. So in the enroller admin view, I can create and view a prospect as well as see the agents and agency sites and enroll, all that good stuff. So that's where I can see selling permissions from that admin view. So as an agent or an enroller broker, your selling permissions are preloaded. That's based on your NPN number. And then when we get to the plans list, I'll kind of show you what it means when you're seeing what you're licensed to sell and how that all kind of is laid out. Next, I'm going to jump to the member's profile. We're actually going to work on the recommended workflow at the bottom of the page. The recommended workflow is part of this little gray taskbar down here. If you're more interested in the choose your own adventure route, as I like to call it, you can select that member's name in the drop down and also go to the same list of pages there in a different order. So totally up to you, whatever's easiest. I'll also point out that you do have the call recording feature on your site. How this works essentially is if you wanted to record the call with the beneficiary, first you'd want to search and identify a member and putting them in context, as we mentioned earlier. So then you can start the call recording to that beneficiary. The phone number that you'd be calling from and how that displays will be listed here. So it's that 888 number. As far as which number to call the beneficiary on, it's pulling in their primary and mobile based on their profile information. You would essentially select call beneficiary. You would allow the use of the microphone through your computer browser, and it would ring. So through that modal, it'll take you through those steps. So we'll go ahead and cancel for this, but that's where that lives. So we can already see that a call recording was initiated and that activity has taken place in the notes field. I'll also point out that copies of that call recording, that MP3 file, If you're an administrator, you would have access to extract those. So if you are not at an admin level, simply reach out to your administrator to receive a copy of that MP3 for those recordings. Further down, we're going to utilize the recommended workflow and start with a scope of appointment. So there's several different ways to capture an SOA. You can complete the form in person, which in that use case, selecting this would just populate within the same taskbar here, the initiation of the SOA form. You can complete this by phone, print a copy of the form, or upload a paper copy as well to the website. You can also email or text the SOA. So I'm going to show the modal here. What happens when you select email, you'll see a confirmation at the top within the modal. Assign the specific due date. So we can push that out. And this will generate a task, but we can also fill this in if we want to change the task name. We'll go ahead and add that. So that'll be added to the scope of appointment activity section. And let's go ahead and switch gears for a second and see what the member sees when they receive that scope of appointment form. So when a member checks their email, this is what that SOA link looks like. So we have the logo up there. It's introducing to the member. So we're identifying the member, and we can see that agent, you as the agent, your contact information, phone number, profile picture, if provided, would all populate down here next to your NPN. Then following this complete scope of appointment form, the member would select that button, and this will take them to the scope of appointment confirmation form. So it's here on this page that a member can confirm and check all the products that they want to discuss with their agent. This is where, as any kind of authorized representative information, it's just explaining all that in greater detail. The member's name, contact information, and then the checkbox to say everything is true and correct. I would submit the form as the member, and this is part of that confirmation. I'm going to switch back to the agent perspective, and we'll see what they see on this side. So if I refresh the page, I'm going to see a real-time update. It's been completed by my beneficiary on this date. This is a quick summary of the products that they're interested in. I'll select complete the form. And as you can see, this is part of the scope form that the agent completes on the next side. So I'll fill in the initial method of contact, select the plans represented during the meeting, the date the appointment was completed, which in today's kind of speedy use case was same day. So we'll leave that as today's date, check that everything is true and accurate, authorize, and submit. We'll then get a confirmation here that this scope was completed with the green text populating with today's date, as well as that confirmation number. Now, if you need a copy of that scope of appointment, simply select the view next to the paper icon, and that's going to give you the SOA copy in a PDF in this format. So if you need that receipt, it's all represented here from the client side to the agent's completion. If we navigate back to the profile, we will also see where that has updated here with the scope of appointment activity. Next, we're going to go through the preferences flow. Within preferences, this is where we can select optional information such as medical prescription drug coverage. We can account for extra help paying for prescription drugs, which we already selected this from the profile level, so that's why this retained. So it looks like this member might qualify them for D-SNP plans. The second page for preferences is part of the health and wellness chart. So we can gauge a member's health status from generally healthy to significant health needs as applicable. Their age will auto-select on the corresponding value here based on their birthday. So you don't have to do the math there, it'll select it. And if you'd like an estimate of medical costs specific to a plan's benefits, maybe there was an uptick in x-rays or special visits, you can account for those visits and uses. If there's an applicable field to account for the number of days, you can increase those numbers or changes you need and restore to defaults if you need that as well. I'll go ahead and save those updated answers and then continue to the next page. Within the zip code search field, and then we can begin to search for a provider in the area. There's several values you can search on, whether it's general practice, value-based care providers, facilities or clinics, urgent cares. So depending on what you need to search, you can isolate those fields and select the applicable doctor. As you can already start to see, if there's multiple locations for a provider, the system will identify those. And when it comes to selecting a provider, we can specify if it's a PCP, one or more locations. And in this instance, I'll have a couple more here. And this is where you would see the primary care provider as well as the new patient designator. The next part of the site in preferences flow is prescriptions. Now, I know we mentioned earlier there is a connection email setup that you can trigger through the mymedicare.gov connection. So essentially what this is as a tool, you would select send email, which is going to send an email request link, special link for the member to log into their mymedicare.gov account. This is a task creation modal. Just keep things efficient there. So we can see that the email was sent and we're waiting for access. What this does essentially, and I'll show you what the member gets, their email request for that mymedicare.gov connection. This is a useful tool where if the member has maybe a big list of drug data, the member would just have to log in to their account and that would send over the last 12 months of prescription cabinet data out to the site. So that's what that email looks like. It still has your agent contact information and the logo so they know where it's coming from. So if we're not utilizing mymedicare.gov, not a problem. This is how we can add prescriptions here by typing them in, start to find that specific dose and form, quantity and frequency. If the beneficiary uses a maybe more expensive brand name drug, the system also works to identify any kind of generic equivalents that might present a cost savings. I think the best practices with this, right? Agents are not prescribers by any means. So what we're doing here is adding this maybe to the list of prescriptions that atorvastatin calcium is a good alternative. So we'll go ahead and say yes for that and say add. It'll populate, but then down here, that'll populate. But then the member can take a copy of the quick quote, which lists out that prescription, take that to their provider, and then they can see if that might be a good equivalent, plus a beneficial cost savings for that member. The last part of the site flow of preferences is going to cover pharmacies. So you can add a specific pharmacy name or go off the list through the zip code search here and also look at the map. You'll see that first one I selected, put a star next to it. That is the indicator that it's the primary pharmacy, but you can change which is the primary designated pharmacy by just clicking this hyperlink text. For this use case, I'm going to showcase Amazon as well in looking from the digital pharmacies available as well. So now that those have been selected, we'll continue, and now we'll get to the plans list page. From the plans list page itself, this is where we can see the zip code and context from that member's profile information. These are dual plan year sites, so I'm showing you the 2025, but you can select and look at 2024. And depending on what you're licensed to sell, this is where it's recognizing there's, 2 Medicare organizations with 23 plans for 2025 that I, as the agent, am licensed to sell. And then I can also see these divided by these different tabs, the different plan types, all the way from my MA, PDPs to MedSup, as well as ancillary plans. In scrolling down from the plans list page, I can also do additional filters, like seeing just specific SNP plans, a specific deductible range, additional benefits. And what you're already starting to see is I have some demo plans here today. So that's why a provider isn't populating. Those aren't real carrier networks, so that's why. But you can kind of use your imagination. This is part of the formatting that will populate under providers to show that they're in or out of network. So it looks like we have a couple of prescriptions on formulary that are included in this FlexCare plan. Another thing that has been updated to these plan cards, they're a little bit cleaner look and feel, all the way from the formatting to also how things are organized. So if you want to see add-on coverages, those plan benefit highlights, that summary is in that additional field. I can hide these details or view more. And I'm going to show the function of a quick quote. So as you can already start to see that gray add to quote button, I'm going to select 3 at a time. And what generates at the top of the page is a quick summary from the plan name itself with a hyperlink back to that specific plan, which we'll see more plan details later on in the training. We can also see the monthly plan premium at a glance in this kind of side-by-side view. If we need to remove one, you just select the X and select the add to quote again. Then once I select the send quote button, a modal will populate where I can email, text, or do both as far as distributing a copy of the quick quote. What you're seeing down here is an additional message that'll pre-populate, but you can also add to this. You'll see a quick summary of the plans included, as well as the pharmacy designation. This is not a permanent setting. You can just send, for each quote, 1 pharmacy at a time for the initial costs. And then I'll show you how a member can be empowered to see a little bit more beyond that. The next part of this step is a modal task creation that's going to show me the authorization code. Now, to view the quotes, we will need to utilize the authorization code. But you'll see kind of through the member experience and the agent side, you always have a copy of this historically. So this will be tied to the member's profile if they lose the email, but you can always send out a new quote too. It's totally up to you. So I'll go ahead and create a follow-up task for a couple days out to follow up on this quick quote. And I'm going to switch gears again and see what the member receives from the quick quote side in their inbox. So we'll see that first email with the authorization code, as well as a link in that second email. So here's the link to the quick quote for the beneficiary. And as this loads, you're going to see from the consumer-facing side where that authorization code box lives to enter that in. And the way our sites are set up conceptually, it's an omni-channel solution, which basically means that based on that user and who they are in that site experience, the sites talk to each other. So if this information looks pretty similar to that layout, that's also a piece of it. But the design was also intentional, so we can, have that transparency in the conversation, but also make it more time efficient when navigating, through the different perspectives. So again, as a reminder, I'm looking at this quick quote as the beneficiary. So that same information I provided to my agent, I can confirm my contact information. I can make changes to preferences if that's applicable here, as well as see the specific plans that I want to pick as well. This is that apples to apples kind of side-by-side comparison. And I'm also able to read about additional coverage types, shop more coverage plan options as a member, or compare these plans. So if you remember what I said earlier about the estimated cost, the member is also empowered to change that and view what the costs are. You have the same tool as the agent, as well as this cool little checkbox here to highlight plan differences. So as the member, just to remind you, again, kind of orient, this is where I know my agent's contact information, the phone number if provided would be here as well. So as a member, if I need to do any changes or if I'm just getting, need that agent assistance, I can contact them here with that information. In navigating back to the agent site, I'm going to show how we can utilize a cost comparison. So if you select the Add to Compare checkbox here off the demo, these plan cards here, I'll go ahead and select Compare Now. And similar to the consumer site view we saw earlier, we can see that layout between plan comparison. I have the same functionality here to see the cost based on specific pharmacies as well as any differences. This will show me the medical coverage benefits across the plans and how those compare. So if it's not highlighted, these are standard and the same across all three in context. And as I scroll down, I can see that preferences information. Again, this is demo plans, so there's no provider data, but that would be where it populates to show in or out of network. This would be the covered prescriptions or not covered alternatives. So we can follow those prompts to find alternatives if that's the case. And then we can see that specific pharmacy in or out of network based on which one. And at the bottom of the site, you'll see the additional add-on coverages. So we can see more dental information if that's available for basic service coverages and plan documents. So as those are determined by the carrier, plan documents are like your summary of benefits, your evidence of coverage, docs, those sorts of things. So let's say that the Demo FlexCare MAPD Plan 4 might be the best fit, and we want to see additional information on the costs and the breakdown. We can do that by selecting Plan Details. So the way this is kind of organized is these different tabs cover these specific sections of the plan details. So plan details is kind of that general summary, similar to what we saw earlier, but at a more kind of zoomed in view. So as I look into medical coverages out of network, I can see that as well. Pharmacy coverages, my retail costs, go into 3-month supply costs. And then we'll see that summary there from the preferences flow again. We get into add-on coverages, those summary of benefits, plan documents. And I have the same functionality tool here for cost-based. I can navigate and kind of toggle through the different prices in the same session. I can also add the hospital indemnity plan from this page or further along in the cart as well. When I select the prescriptions tab, this is going to show additional information for specifically the covered prescriptions, as well as the applicable tier or non-covered prescriptions, which it looks like I should have picked a better plan. But if I need to, just case in point, I can look for alternatives. And it looks like there's a few others that I can select. Swap those out. Next, in health costs, we can see those benefits, as well as the visits, use cases, and the estimated medical costs on the right-hand side. Things related to total estimated costs. This is more of a calendar view, sort of looking ahead. This is kind of a fun first example. It looks like for January, it's a little bit more expensive in the first month, but then kind of tailors back a little bit. But this is a great calendar view. If you're a little bit more visual with looking at this information, I definitely recommend this tab under Plan Details. So let's say that this is still a good fit, that Demo FlexCare MAPD Plan 4. I would select Add to Cart on that yellow button. And here's that prompt for the hospital indemnity plan as referenced earlier. You want to add that. The optional additional add-on coverages are accounted for here to add. We would select those applicable buttons. Now you can pre-fill out the form and send it to the beneficiary to review for sign and submit, or you can complete the form yourself. I'm going to kind of demonstrate that use case. So think of it through the perspective of maybe we're sitting side by side on the computer with a member and completing that form with them. I will also say to keep in mind, this is a demo FlexCare plan. So some of the requirements, right, it's always going to be the requirements are driven by the carrier. So because it's a demo plan and it's a demo carrier, I have a lot of bells and whistles turned on for this. So that's just something to keep in mind for the form. They all vary, slightly in some requirements. What you're seeing in front of you now is the pre-enrollment statements. These are part of the CMS compliance. This is a modal piece strictly for the compliance piece. So you'll see specific agent notes for yourself as a reminder for the recorded calls and to make sure this is read aloud and these benefits are covered with the member. I know this received an upgrade where there's just one checkbox now versus per item. So quite a few less to check off, but we still have some important required disclosures accounted for here that would also be checked off. We'll select continue applying. And then in this enrollment form, it looks like this one is 7 steps. I've seen some that are 5 or 6. It just depends, again, based on the carrier. So the first one of this enrollment form is current information, so your contact info as well as address. I'll also point out these received an upgrade, so it's a little bit fresher, clean look and feel. We're more intentionally trying to stack the white space a little better. I think some of the feedback I heard is it feels like a paper form in some ways, which is kind of fun. So I know that was improved in the last year. Next, for this enrollment form, we're looking at eligibility information. So we'll count for those Part A, Part B effective dates. This is for prescription drug coverage. So if there's additional coverage to account for drugs, we can account for that in the plan. Next is going to cover ethnicity and race, as well as accessibility format, employment history, gender identity. So just all your standard CMS compliant required fields, email information. So if the member wants the plan formulary summary of benefits, you can account for sending that their way and continue. This is the payment information. So for paying the plan premium, in this case, we'll go ahead and select get a bill. And then we can see the agent information. This is part of that attestation that everything is correct and true. Another compliance piece, statement of understanding. So again, just making sure everything is attested to and is tried and true. Say that 10 times really fast. And then further down in the form, we can account for that relationship to the person enrolling. So select what is applicable. And throughout the site experience, any of those red asterisks is going to be the required field. So just know that that's why you're not able to move forward if that's going to kick you back, if not everything required is selected. So in this case, right, our use case was we're sitting side by side with the member, sharing the computer. So this is where I can have the beneficiary sign. And then I put my agent signature. And we'll continue. That was an example of like a wet signature. Some of them require voice signature. It really just depends on that specific enrollment. And this is my review and submit page. So you're all going to have a chance to review it before submitting. That's that voice signature I was talking about. So we have some other bells and whistles turned on for this enrollment form. But just to point out, that's where that lives. So once I select the submit button, it'll take us to the submitted application submitted page. And this is that confirmation. So this has been sent to the carrier. We can see the application details, the member's name, quick kind of summary of their address, the submit date, as well as a copy of the confirmation number for this application. Now we can distribute this copy or save it as a receipt by viewing a copy of the application through this hyperlink and the paper icon. That's going to give us the PDF download. So you can save this as well. This will essentially be that receipt capturing exactly everything we saw from the enrollment form and what was selected, all the way down to signatures. So I'm going to navigate back to the member profile for a second, and we'll see where some of that historic information has now taken place. So we know that the scope was completed. I still need to follow up on the mymedicare.gov connection, so we'll leave that. But then we get into the history. So that quote history we talked about earlier, this retains all this kind of important details. So the date and timestamp of when that was emailed to the member, the quotes that were sent in summary, the authorization code to access the quote and the plan type, as well as the personal message and what I added to it retains along with the agent's name. Any kind of enrollment history, same thing as far as date and timestamp, that will retain. We can see the reminder to complete the HRA, which is here. We can view the application again, as well as access the enrollment confirmation number. So that lives on the member profile, so you still have that historical data. And now we can see if we navigate back to dashboard, those activities have taken place with just that mymedicare.gov connection that's left. So that pretty much covers kind of the end-to-end agent training of the site. So now would be the time I'll open this up for Q&A.